Hello, welcome back to my channel. I am OKGod. If you're a new subscriber, thank you for coming, and if you're an old subscriber, I appreciate you for coming back. So please quickly give the video a like, that's a thumbs up. It will help it to go far. In today's video, I will be sharing with you one of the interventions that medicine has come up with to help people who are battling with infertility and probably they cannot be able to wait for natural conception to actually happen. So in this video, I will be sharing with you in summary all you need to know about IVF. What is IVF? It is an acronym actually. The acronym is for in vitro fertilization, meaning something that is done outside the body. It's actually a medical procedure where an egg is being fertilized by the sperm in a test tube or elsewhere outside the body. So that is otherwise known as test tube babies. Yes, I remember when IVF came in to Nigeria, for instance, it was initially called test tube baby, and that explains why it is being called test tube baby. And this process involves monitoring and stimulating a woman's ovulatory process in order to harvest the eggs for the sperm to fertilize it. In return, the fertilized egg is being taken back to the woman's body, that is the womb, and allows it to continue to develop and grow. So, how long does it take to get pregnant with IVF? Yeah, one cycle of IVF actually takes about 2 months, and women that are younger than age 35 gets pregnant and have their baby. With their first IVF, an egg retriever, including the subsequent transfer, half the time of that cycle, that is within that period of 2 months. If you are age under 35, that is what will actually happen, meaning that your chances are very high. And it might interest you also to know that the first IVF baby the world has produced, or medicine actually produced, is around 43, 44 years old now. So that makes the intervention something that is very open for anybody who is willing to venture into it or to go through it, to have that soul consolation that it's workable, right? Yes. So you may want to know, what are the reasons why people go for IVF? What are the possible reasons for IVF? Okay, IVF may actually be an option for the following reasons. Number one being that when a person is unable to get pregnant naturally, or otherwise what we call natural conception, they may want to go for IVF, considering the length of years they must have tried. So IVF could be an option. The second reason would be a couple that has been diagnosed of an unexplained fertility problem. So a lot of diagnoses have gone on there, but yet nothing can be traceable to say, okay, the man is having issue, the woman is having issue. That is the reason they are unable to have children. So IVF would be the right option to have their baby. The next reason would be male factor infertility or abnormal sperm perimeter. Such couple will want to go for IVF. And the final point here will be as a result of a fallopian tube that is actually blocked. So cases of fallopian tubes that are blocked, and the reasons I have mentioned before now are the possible reason why IVF will be an option for persons and couples going through such. Now, the IVF itself is a process according to the Human Fertilization and Embryology Authority in UK. Actually, one IVF treatment or cycle can take between 3 to 6 weeks. However, a person may require more than one cycle depending on their risk. The success rate of the treatment and the techniques that are being used, because these techniques differs from one clinic to another. So a particular clinic technique of doing IVF might be totally different from another clinic's IVF. So these are dependent upon what will make the process to come out to give you a better result. So let's look at the steps involved in IVF. IVF actually has 4 major steps that a person, a woman that will be going through it will have to go with. Number 1 of those steps is what is called superovulation. Superovulation, this is also known as controlled ovarian hyperstimulation. Controlled ovarian hyperstimulation. So in this case, fertility medications contains either a luteinizing hormone or follicle stimulating hormones, and these hormones are actually responsible for stimulating the ovaries to produce more than one egg. Usually the ovary will produce one egg most of the times, but by the virtue of this stimulation, the ovary is being made to produce more than one egg. So that is what the luteinizing hormone and the follicle stimulating hormone does. So a transvaginal ultrasound is responsible to monitor the progress and the growth in the ovaries. So the another alternative in case you don't want to go through such, you can use a donor's egg or a frozen egg. So that is that about superovulation. All right, the next step in the process is retrieving the eggs. Retrieving the eggs. Doctors use a minor surgical procedure known as follicular aspiration or egg retrieval to collect eggs under ultrasound guidance. So normally a thin needle will be inserted through the vagina and into the ovary. The needle is then connected to a suction device that removes the follicular fluids and the eggs. So doctors perform the process for every ovary. Of course, every woman has 2 ovaries. So this process of egg retrieval will be done to each of the ovaries to collect the eggs that are already produced. Then the third step will be insemination, fertilization, and embryo culture. Insemination, fertilization, and embryo culture. So in this case, the collected eggs are placed together with the sperm, and after a few hours, the sperm should have entered the egg, right? Yeah, that is what is expected to happen in this step 3. So sometimes the sperm is directly injected into the ovary, and this particular process is known as intracytoplasmic sperm. Intracytoplasmic sperm. So insemination, this intracytoplasmic sperm, via this insemination, can be in 2 SI. That is this particular technique is used to inject a single sperm into the ovary to fertilize the ovary. And ICSI is a common treatment technique actually used for male factor infertility. So this particular technique will not be used unless a male factor infertility is concerned, and they will have the chance of the ovary or ovum being fertilized. Also, couples who have undergone a failed IVF cycle, ICSI technique will also be used for them, and success is actually being recorded. So as soon as that is done, the fertilized egg then divides and becomes and reaches the blastocyst stage. Many fertility centers will always carry out what is called PGT, and that is known as pre-implantation genetic testing. Pre-implantation genetic testing. And this test is carried out on the embryo in order to detect if there is a chromosomal abnormality, or what is called aneuploidies. So, the transfer uses the best of the embryo, that is, after the test has been done, uses the best of the embryos, and that is where embryo grading comes in. Grade A, B, C, D, grade 1, 2, 3, you understand? So, your doctor will use the best of the embryos, and then the woman will be prepared, the person will be prepared to receive hormones and other medications to prepare the wall of the uterus for. Number 4, embryo transfer. Sometimes the embryo transfer may be more than one, depending on what you have discussed with your doctor. So your womb will receive more than one embryo. So you make sure you discuss it with your doctor, whether you want just one embryo to be transferred, 2, 3, 4, 6, as the case may be, depending on how many of the best embryos your doctor have collected. You understand? So it is something you must discuss. So around 3 to 5 days after the fertilization has occurred, transfer of embryo begins by using a test tube or a catheter. It enters the uterus through the vagina. When the embryo sticks to the wall of the uterus, which is also known as implantation, it means that pregnancy has occurred and the baby or the embryo continues to grow. It means that IVF cycle is recorded to be what? Successful. So those are the 4 major processes you will undergo for your IVF. So are there risks involved in IVF? Yes, for everything that is done, every project, as far as human is concerned and medicine is concerned, there is always risk involved. So some of the risk involved includes multiple births. IVF increases the chances of a couple having multiple births. Because most of the time, even when you request that one embryo be transferred, as soon as the fertilization occurs, you don't have power over the division. Do you understand? So that's one of the risks. Then the second risk factor here is premature delivery and low birth rate. There could be premature delivery of those babies, and those babies may come out having a low birth rate. So it's important to know that there are some risks, but I am not outrightly saying that it is the same with every woman. Okay, so the next risk is ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome, probably because of those medications that were used to stimulate you in order for your ovary to produce one egg more than usual. So the next risk is miscarriages. Yeah, there has been cases of people who undergo IVF and after the success, recording the success of pregnancy, miscarriage will occur. So this is also one of the risks. Then egg retrieval procedure complication. Egg retrieval procedure complication. The next one will be ectopic pregnancy. Ectopic pregnancy. So the pregnancy not actually happening right inside the womb, but at the edge of the tube. So that can also happen in IVF. It is a risk. There is also a risk of birth defect. The babies may come out with any kind of deformity. And then there is a risk of cancer. There is another risk of doubling the mother's risk of developing diabetes and significant increase in the blood pressure of the mother. Those are the risks. So, having seen the risk of IVF, are there side effects to the medications that are being given during IVF? Of course, there are side effects, just like everybody reacts differently to different medications. So it is also with IVF process. So some of the side effects of the medications would include nausea and vomiting, difficulty in breathing, irritability, hot flashes, then enlargement of the ovaries, and abdominal pain. Ovarian hyperstimulation syndrome also comes in here as another side effect. All right. The next thing will be, is it painful? Is the IVF process painful? Normally, the IVF process is not painful since it involves the use of medications And these medications are given through injections. So it is not painful, although the site of the injection brings about bruises, of course. When you keep inserting a needle or needles in a particular point, there is bound to be bruises. That's apart. A person may also experience abdominal cramping during this process. The egg retrieval process is normally not painful also because painkillers or pain medications will be given to you. So the process will be painless. And the embryo transfer, of course, is not usually painful. So in a whole, we say IVF process is not painful, apart from the bruises of the injection site. What are the success rates of IVF? So according to the CDC, that's the Center for Disease Control, estimated for the egg retrieval percentage and the resulted live birth of IVF, they noticed that 52.7% among people aged under 37 years that have success of IVF, which means people that are under 35 years old are around 52.7% that recorded success in IVF. 38% among people aged between 35 and 37 years old, 24% for people aged between 38 and 40 years old, then 7.9% among people over the age of 40 years old. So this statistic actually varies depending on where and the procedures that the IVF went. Okay, so meaning that the more your age, the lower or the decrease in the success rate of your IVF. Secondly, the techniques used in carrying out such IVF. So these are the two major conclusions from this data-based statistics according to the CDC. But there are other factors like age. Most importantly, age is the most important risk factor that affects the success rate of IVF. As you hear me mention earlier, 7.9 among people that are above 40 years rate have a success in their IVF. Okay, however, the likelihood of success can depend on other factors, which include the cause of infertility. So those are other factors that will determine whether the IVF is going to be successful or not. The ovarian test results, I mean to say. Then number 3, whether or not pregnancy and live birth has occurred before now. And finally, the kind of strategy, meaning the techniques that is being used or that will be used on you during this IVF process. So, what is the cost of IVF? Okay. According to the average cost of one IVF in the US varies between $10,000 to $15,000. So when you convert it to Nigerian naira, you know how it is, which means it is cheaper there. But be that as it may, there are some insurance that covers the treatment and medications for IVF. So people that have such insurance, that is in the US of A, will actually undergo IVF treatment lower than $10,000 or $15,000, for instance. Now the question is, in Nigeria, do we have a workable insurance policies? Okay, you will give me that answer, or you answer it yourself. Coming down to Nigeria, the cost of IVF is very, very, very outrageous, ranging from 2 million, 1.2 to 2 million naira, depending on the clinic anyway. So, but there is no IVF clinic that collects anything less than $1 million naira. Alright, an IVF mother. So, the way you calculate your due date when it has to do with natural conception is totally different when it has to do with IVF. So, a person can calculate an estimated date of delivery by using a due date calculator. You go to the website, so many websites have it. But before you go to any website to download, it is dependent upon the date the embryo was transferred and the type of transfer that was done for you. So how do I mean? In case you are looking for such app, what you go for is, depending on what I have mentioned before now, the date of transfer and the type of technique used for you. Day 3 embryo transfer, due date calculator. Day 5 embryo transfer, due date calculator. IVF with own eggs, that is if it is your own egg that was used, there is also a calculator for that. IVF with fresh donor eggs cycle, then fresh donor embryo cycle. So these are the ways to calculate due date for IVF. And I hope I've been able to summarily given you the basic info you have to know about IVF. So if you are open to it, grab it and record a success. And I will see you in my next video talking about other interventions medicine have brought in to help people suffering with unexplained infertility. Bye.